everybody, this is Shani Caviness from HKB Surgery. Thank you so much for joining us today. This is my model Kate, and we're pleased to have you to go over one of our newest and exciting products out there, RHA. Now this may be new to our office because we were the first provider here in Charlotte, but this has been available in Europe for over 5 years. It's actually a Swiss-made product, and we know good things come from Switzerland. So the benefits of this product that I'm hopefully going to show you today is how it creates and diminishes the folds here, but with a soft, natural look. These products are made of hyaluronic acid, which is something we already have in our body, and this is the one that is most natural and related to our own body chemistry. Fewer additional chemicals, which a lot of people appreciate natural these days. I have used this product in my own temples. I've used it in our lips in the office, and what I really like about it is there's less swelling, less inflammation, and a wonderful movement created with it. You can't tell that there's a filler involved, which is what we're looking for these days. We want to have a natural look. So today we're looking at a couple of areas. The nasolabial folds are a very common issue with patients. Sometimes this is because we don't have enough height in our cheekbones. We don't have enough filler in our temples. As we age, you'll notice that when we lose weight, we lose the fat there, but we also have fat pads that transition down and become leaner. So we just don't have a lot of support. That lack of support will lead to nasolabial folds. Now at this point, the nasolabial folds are deep enough where I am going to inject in this area today. It's a sensitive area, so we use numbing prior to the procedure. And thankfully I have numbed Kate prior to. She's not allowed to scream live, right? So, just a little bit about me. I am a PA. I've been injecting for 9 years. We have incredible injectors in this office. Mina is an expert injector. She actually trains people. We also have Tiffany that's an RN and is available. I do want to point out that yes, my face looks insane today. I did CO2 laser all over my face and neck, which kind of is a good introductory to all of these products. Nothing should be used just one product or another. If we use a combination, you're going to look fresher, you're going to look younger, you're going to keep the lines off your face. Do the combination, do the lasers, do the Botox or Dysport, but by all means do your fillers because those fat pads are going away with age. There's nothing we can do about it. And it's instant gratification. You're going to see these areas pop out and feel immediate today. Now with any filler, I am going to review risks. With any filler, there is potential to block a blood vessel. That is why you want to go to a trained and experienced provider. These products can be dissolved, but you have to know when there's an issue, if the skin would darken, become tender, or become very light because there's no blood supply. That is an emergency where we immediately need to dissolve the product. So please go to an experienced provider, and that would be our office, of course. So, getting started today, you may see Kate at times if she's uncomfortable. She has something here. This is called a distractor. I will have patients hold it against their cheek. It distracts their nerves so they don't feel as much discomfort. All right, we are going to go ahead and get started. Are you ready?
I'm ready.
Wonderful. Okay, so first, because we're injecting under the skin, we use a cleanser. And we want to be particularly careful because these people are seeing, Miss Kate is in front of a lot of people. She owns Poppy's up in Huntersville at Burkdale Village. Excellent for gifts. Go get your monogrammed items. This poor woman's going to be exhausted by Christmas.
I won't look at them.
She won't look at it. She's going to look so refreshed. All right. So if you've never had filler, this is what it looks like. It comes in syringes. We sell by syringes. This is different than Botox or Dysport. Those are sold by unit. You would purchase a syringe, and because this is New today on Facebook Live, we are taking $150 off this syringe today. So please call our office, 704-659-9000. Say, I want the new product. I want the RHA. This product comes in level 2, 3, or 4. Those different levels correspond to different anatomy of the face. So if we want a thicker product or a more stretchy product, that is how we determine which number we'll use. Today I'm using number 3. I want a decent amount of stretch and a decent amount of strength to support this area. So first I'm just going to have Kate lean your head back. All right. Once again, tender area. All right. You on this side here?
Mm-hmm.
So I'm just going to prime my needle. So we have the product, and I'm going to insert into the area. We always draw back to make sure that there's not a blood vessel in there. You okay? Okay. Gotta love live. And I'm going to use a fanning effect. You feeling pretty comfortable?
Mm-hmm. Yeah.
Excellent. Surprising, yes. So you'll already see that this is starting to pop this area out, and we massage. Nice. We massage just to make sure it's a nice shape under the skin. And we're going to go back in. We're just going to follow this line down the side of the face. Excellent. Now you always want to make sure you're not going above that fold, because then we're going to make that fold heavier. So we want to just fill in this line here. Once again, this is our latest new filler at HKB, Swiss-made product. Call us at 704-659-9000 to get your $150 off your product. We have excellent injectors. Mina, Tiffany, Shani, all the doctors, of course, are brilliant. Excellent. So I also like to give some support to the areas that have some folds. So I might cross bridge. What this does is help support, like on a chair leg. You have chair legs that come across, gives it support, so that fold won't be in that area. All right. Here's a benefit. Most of you ladies come in and you're asking me, well, how long is this going to last? You want your bang for your buck, right? This product doesn't last the typical 6 to 9 months other products do. This product is going to last about 15 months. Bang for your buck right here. Okay, so you have a softer, more natural product that has longevity. Not bad, right? Once again, it's called RHA, which stands for Resilient Hyaluronic Acid. You can ask for the Swiss product. And bring chocolate.
And you get chocolate.
Bring chocolate. All right, we're just going to keep filling this line here.
I don't feel anything.
Good.
Very good.
It's a nice soft product. We have awesome numbing cream because I know a lot of people are afraid of needles.
I don't feel anything.
Excellent.
Okay.
A couple different techniques we can use for filler in the different areas. Now, once again, this product is only available at a few exclusive offices. Ours was the first to have it. So you can't just call any place and ask for this. This is an exclusive brand. Ah, it's already looking a lot Yay. Just softening that up. That's what I really like about this. It's very pliable, integrates nicely into the tissue. And ultimately, that's what we want. We want it to integrate right on in there. It feels natural. It looks natural. We don't want lumpy bumpies. All right. Love it. Love it. We just keep building. So you don't forget, you want to keep a program. You've got your Botox or Dysport to help reduce the wrinkles. Fillers are typically here down. There are danger spots for fillers. Tear troughs, there's some vessels that come out under here. Please don't have somebody inject you up here unless it's a physician that's very aware of his landmarks. You could actually get filler into a vessel and go blind in that eye. So there are hazards, so you go to an experienced injector, like HKB. All right, I'm going to start working on the other side. Hopefully, if you guys have any questions, please feel free to call us or email me. 704-659-9000 is our phone number. I have an Instagram, Skin, Body, and Soul by Shani. I do a lot of my before and afters. We invited Miss Kate here today because she's a female small business owner. We appreciate that. We love to support her.
Thank you.
All right, we're going to start on this side. You can already see how nice and full this is and how much, look at the line. I don't know if you can zoom in. I have her lovely daughter as my IT technician / videographer today. It's Girls' Day. All right, I'm going to come back under here again. Same thing, danger area, so we're just careful to make sure there's no blood vessels blocked. That's one syringe. I'm going to get my next syringe. Hopefully you guys have some questions. We're always around to answer. We have friendly, knowledgeable staff. I have to say, I've been with HKB. This is my second time back at HKB. Left briefly, came back because it's so supportive. I work with the best surgeons, world-renowned surgeons. They have textbooks out. I'm sure a little light reading. Dr. Bahardi and Dr. Cortez's just put out a new book. So congratulations to them. I know Dr. Hunstead has chapters on the bra line back lift in books, on facelifts. We've got some talented people here. All right. She's doing great. Hopefully you can see. These lines are just filling right in. Nice and soft. Nice tissue integration. You know, if nothing else, ask your other half for a good Christmas gift. You could put some fillers in their stockings. You can get a gift certificate from HKB. Put it in a bag for poppies.
Sounds like
That's a good plan, isn't it? It's a great plan. Get it monogrammed. Take it to the beach when COVID's over. Yeah, this pandemic is almost over, people. Those masks are coming off.
Yeah. Then you'll be able to see all this, right?
That's
Not
right.
behind a mask.
No more hiding behind the mask, people. Come on in and get your lips and your nasolabial folds done.
Everybody's been concentrating here up.
Exactly. Exactly. Ah, Botox on the forehead won't be enough anymore. Come on in for these lines around the lower face. Excellent. So there is potential for bruising with any fillers. Anytime you put a needle in the face, there's potential for the bruising. Right now, it doesn't look like she's going to have any major bruising. She just has great skin, great vessels. So we're just going to keep building on this. I'm going to finish these areas, and then I'm going to come across to her temple, and that'll be easy. There's a couple of methods. So there's this method where I go directly into the areas, and then there's a method with a cannula, which you'll see is I'll literally put one needle in and track through that so I don't have to stick her multiple times. That helps with bruising as well. I don't know how well you can see this on the video, but it just plumps the areas right up, just immediate. Now, some people need 1 syringe, most people need 2 to 3, but you build over time. You don't do it all at once. You can take your time and build. We're not going anywhere. Now, some things after filler, you don't want to have a lot of super hot or super cold. You don't want to have your flu shot within 2 weeks. You don't want to have dental work within 2 weeks, because we are putting a foreign substance in the body which can potentially create some inflammatory process, and that might make those issues worse. So just a couple of things. She'll want to keep her face washed. She won't want to put a lot of makeup on the area just for the next 24 hours. Do you want to touch your skin and see how it feels?
Mm-hmm. Oh gosh.
Pretty soft, isn't it?
That was really good.
Yeah, nice, soft product, integrates nicely. When she smiles, it's not going to make a lumpy look. It looks really nice. But that's what I think I like most about it. It's so soft. So soft. When I do lips, it's insane. It's so soft. Love it. So hopefully everybody's checked in and found out something new about the RHA fillers. We do have different levels. It can be used in the cheeks, the temples, the lips, the nasolabial folds, any line on the face. It's soft, it integrates nicely, there's less swelling. I can't tell you how many times I've seen lips just blow up overnight. And it's not very comfortable. So this is comfortable, very tolerable. You saw Kate could feel her skin. It's not lumpy bumpy. Feels soft.
It feels really nice.
So we're just going to keep going with this. Introductory rate, $150 off a syringe today. Call and ask for the RHA fillers. Any of our team can do this for you. We're always happy to see new patients. We can talk to you and walk you through it. We do numb you beforehand because I know it can be intimidating to have a needle coming at your face. We take very good care of you from the front to the back. The friendliest staff around. We truly love our patients. We're looking forward to seeing you. Get your masks off soon with COVID-free. We're going to have beautiful lips and beautiful faces after this. So I'm Shani Caviness, and I'll look way better in another week once my CO2 laser has peeled off my face. If you have any questions, please email. I'm at shani@hkbsurgery.com. I have an Instagram, Skin, Body, and Soul by Shani. Our staff is waiting on the phones to take your calls. $150 off your fillers of RHA. Give us a call, and it was a pleasure being with you today.